Good afternoon and a warm welcome to Drive Time. My name is Idrees Rashid, and big thank you to Baker for allowing us to interject into his program. We've got a very special Cancer Connect program today because it is my pleasure to have Dr. Jonathan Ferguson, a consultant cardiothoracic surgeon. Can you pronounce that word for me?
Cardiothoracic. Heart and lung.
Heart and lung, and you're a cancer lead, and you're very kindly given up some of your time to come and chat to us about cancer today, but not just cancer, because we've been working on this Cancer Connect project, and you've very kindly been supporting us. So, as a way of introduction, would you like to our listeners and our viewers know what Johnny Ferguson does?
Well, I suppose firstly, my accent. I'm a Belfast lad, so I'm not a local. But I've been here since 2007 as a consultant surgeon. I was brought in to deal with the amount of lung cancer that we have in the local area, which is unfortunate, but provides a lot of work for the team and me. And it's been a pleasure here. It's been great. And I've met my wife in the local area and brought my kids in here, and we wouldn't go anywhere else, and we love it here, so we sit down some roots. But my main lead now is to health inequality, so we bring equal care to everybody, that everybody gets a fair crack, equal opportunity to get treatment and to have what they need and to come forth. And as I say now, it's actually, for me at my stage, mid-50s, Idrees, is that the hardest thing is to find cancer, not treat it. Treating it actually is quite straightforward, but finding it's not the hard bit. So getting people to come forward and to get their stuff done is what we want to talk about now.
Definitely, you talk about lung cancer earlier on while we were off air, and we're going to go into that. But just a little bit about Cancer Connect project, because this project came about a conversation between yourself and Carol Taylor as well from...
Carol Taylor, tour de force.
Yes, definitely. Big thank you to her as well. So this conversation, I think we were on Albert Road having a coffee, and we were thinking about how can we get more awareness within our diverse communities about the different cancers and the different opportunities in terms of screening and how people can make sure that they get the earliest opportunity to diagnosis.
And I think having that coffee in the centre of town was actually what it's all about. It's all about breaking down the barrier of the front door and the wall of the hospital, realising people can come in and get treatment, because there's so much more going on now in terms of early diagnosis and early treatments. And the earlier you get this stuff, the more chance you have to be cured for it. And bringing in the community as a whole, whether community leaders or faith leaders or people playing the arts and crafts, whatever way you can do to get people to take screening seriously, take prevention seriously, to modify their lifestyle to try to avoid cancer. Young people to know what cancer is, and it's not a taboo subject. And the more conversations we have, the more people will get cured. And it's just about demystifying that word cancer that people try to avoid in all communities that holds us back.
Definitely, there's definitely that fear of cancer, and by more, being able to talk about it more openly and having those conversations within our faith organisations, within our communities, within our families, I think that breaks down the barriers. And as the hospital, as a trust, what sort of barriers do you guys face in terms of engaging in communities and making sure that this information is out there?
It's hard to get people to prioritise themselves. A lot of people prioritise each other. They always do. They're big members of their families and they're looking after everybody else. And the last person they think about is themselves. And we're just saying, prioritise yourself for a short time. And if you're offered help, take it up. Because that could be the decision that allows you to help other people for longer. If we manage to cure you of something, I hope you don't get it. But if you do, that we're here earlier so that you're here for the years to come to perform that role within your family and your community to care. But just take the time to do it. And, it's not... The James Cook's not about wagging fingers, it's about open arms. It's about welcoming everybody in. You will get a welcome. You'll be treated with dignity when you come, no matter where you come from. We just want you to come.
I remember when we were at this Lunch and Learn event, and you had this short presentation that you gave, and one of the things you talked about is opening the doors to the hospital. Yeah. And just share your thought behind that, because sometimes, when we think about hospitals, we think about the end of life and dying, and people don't like hospitals for those reasons. So you're there to help people.
We're definitely to help people, and as things get better, then the chance of being cured is more likely now. It's not somewhere to go to die, it's somewhere to get cured. And we run various projects, but every day of the week, my colleagues and I or removing lung cancers of people, and the only reason we remove them is to get them cured. Doing that day in, day out. But I'll say again, the hardest thing is to find the people with the cancer, not actually to help them when they come through the doors. You just need people to engage in what we offer so that we can help you if you're unfortunate enough to have it.
So in terms of screening, you mentioned this before as well, but Tees Valley has a targeted lung health check. Just tell us a little bit about that.
Well, I was asked to set that up, so that shortened my life more, and I extended the patients for a short time. But it's good. It's a lovely thing. We've got an independent provider who comes in and performs about 1,500 scans a month in supermarket and other car parks. So that is a CT scanner and a bag of diesel and a generator. And then the images are whizzed off to an artificial intelligence program. Then they're reviewed by a consultant radiologist, and then we bring them back in. Most of them are negative. Mm-hmm. But about every 2 to 3 days, we find a cancer that we can treat. Now, in the old days, when I came here in 2007, up until that program, about 80% of the cancers lung cancers in this area were for palliation. That means we could not cure them. And 20% we could try to cure. What comes off that van is the flip of that. Mm-hmm. We can get 80% comes off the van, we find, we can try to cure, and only 20% has got to a stage where we can't cure it. So to flip lung cancer is amazing, 80-20 to 20-80. The other thing is that lung cancer is by far and away the most common fatal cancer in every community in the UK, including ours. But it's not the one that gets sometimes the most profile. Mm-hmm. And all cancers deserve profile, but I think lung cancer has had a very bad PR in terms of it's seen as being a death sentence, where it's not anymore. If we get it early, we can treat it. Whether by surgery or radiotherapy and chemotherapy and new novel agents, there's lots we can do. But we can only do it if you turn up.
Definitely. And I think when you look at health inequalities, they are linked with the socioeconomic factors. But lung cancer is one of those diseases, especially if you look at sort of central Middlesbrough and sort of marginalised communities. And when you look at deprivation, there's a spike in those areas. So, and it's important that, we get this information now, and especially about screening programs.
It is important. It is a cancer of the common man. Mm-hmm. That's what it is. And it goes with poverty and with smoking and everything else. Yeah. But it is something that, I always joke and say if lung cancer had been caused by gin and tonic, it'd be very differently organised. It's we need to give people the voice who are doing this. People deserve care because they deserve care. But my goodness, if they paid for it in terms of the tax on cigarettes. These people have paid over and above mm-hmm. their taxations over the years that they deserve the best of care. Everybody deserves the best of care. But we're not if you come to the hospital and you've been a smoker and you've got a cancer, we're not going to give you a lecture about what did you think you were doing. We're just going to help you. It's your life choice. We're not there to tell you what to do. We'll mm-hmm. just tell you what your options are and how we can help you. So you'll not get the wagging finger. You'll just get the open arms.
Definitely. And the first step is, obviously, you mentioned the supermarket car park. Just can you give us a bit more details on that? So what happens? And
so what we do is we go into general practice and we extract the data from general practice to work out who are the smokers and ex-smokers. Then those people are sent a letter, and the letter says either phone us or we'll phone you. So you give them a short time to phone them. Mm-hmm. If you don't phone them, they phone you. Mm-hmm. And they go through some questions to see if you are eligible to have a scan. You come down, speak to the nurses at the scanner, have the scanner, and the great thing with the scanner is it's free. Mm-hmm. It's you don't take your clothes off, you do it fully clothed. There's no needles, no pain, dignity's maintained, and the scanner itself when you're in just takes about 10 seconds in and out. So, and then you can go and do your shopping. So if I was offered to have that in a hospital, I would always say no, because it's much easier to get to Tesco car park than it is to get to some of the NHS hospital sites. Mm-hmm. And also, people don't feel they're a patient if they've gone to Tesco's, but they do feel a patient if they come to the hospital. And we don't want people being put off by, if I go and have a scan in the hospital, I'm more likely to find something. It's not that way. Mm-hmm. We want to make sure that people don't associate it with disease, they associate it with cure.
Definitely. And what sort of success have we had so far? You mentioned the 80-20 and 20-80. What sort of numbers are we looking at?
Numbers of cancers found is I haven't got them for this month, but it's roughly working about, in the last 2 or 3 years, we've found 330 cancers, which normally would have presented later, maybe 6 months, 12 months later, in a less favourable fashion.
So you are taking a targeted approach with this data from the GPs, and so if you do receive this letter
Just take it. And if you think that you have told your GP that you never smoked or you don't smoke and it's a little white lie, go and confess, because we can't do a scan unless you're a known smoker or ex-smoker. So just go into your GP what you got, and if you get the letter, just come, because you ask around your neighbourhood, there'll be somebody in your neighbourhood who has had this, and ask them about the experience, ask them how we treat people when they come in under surgery, under my care, my colleagues' care. And I hope universally you hear that people are treated with dignity and respect and that they feel it's a positive experience. It's not positive having an operation, but as positive as it could be considering the situation.
Looking at lung cancer specifically, what's some of the signs to look out for? You mentioned that this targeted approach and screening programs offered, but if someone's been a smoker or an ex-smoker, what sort of things should they be looking out for in terms of signs, early signs?
So things like increasing shortness of breath, or you've coughed up some blood, or you're not feeling quite yourself, or weight loss, that sort of things. It often can be quite subtle things, but certainly if you cough up some blood, that's the main one. You should go and seek immediate advice.
And you can do that through your GP.
General practice will know exactly what to do when you get that. Yeah.
Okay, definitely. So let's talk a little bit about lifestyle as well. And obviously, smoking is a factor, but in terms of diet and
so everybody knows that smoking is bad for you. We're not really. I don't think we need to push that too hard, Idrees, because everybody knows that one. The one that people.
But there is support available in terms of smoking cessation, stop smoking services. So, if you are thinking about it, there's help and support available, both through the hospital itself. I've seen a recent.
Absolutely, and I think the big thing about is the new is vaping, isn't it? Everybody's talking about vaping. And, vaping is better than smoking. So we use vaping to get people off cigarettes. That's a good thing. So my maternity colleagues, Ellie, in the maternity, has now got over 100 babies born who were conceived with smoking parents who are now born to non-smoking parents using vaping. It's 100 kids. That's like maybe 4 classrooms of kids in those 2 years are smoke-free families. That's enormous. However, if you're a non-smoker or non-vapor, don't start the vaping, because it's definitely not good for you.
Yeah.
It's just an awful lot better. So if you're coming down off smoking, go to vaping, go to off. But please don't go up that ladder from into vaping and certainly not from vaping into smoking.
Obviously, this project is a little bit wider than lung cancer itself as well, and some of the other cancers that we're going to chat about at a future date. But what's your general advice to people out there, and especially those that have been ex-smokers, but not everyone shares that information with their GPs, and they might have worked in environments, like 15, 20, 30 years ago where, the workplace wasn't as clean. So there might be people that have certain conditions and, what they need to look out for.
What you need to know is there's often stuff we can do. And for families to say, well, what are they going to do anyway? There's no point in me going. That's not a good argument. I think people need to go and report to their GP if they've got a change of symptoms. And they need to tell their GPs if they've been a smoker in the past, because that'll open up what we want to find, which is asymptomatic lung cancer, Idrees. So it's people who don't even know there's anything wrong, because they are the ones that actually we can help more often. We don't want to wait until you get symptoms. We want to get you before you get symptoms. When we look at people who get symptoms, that's the old days of 80% on the wrong side of the argument. We want to get you before you got symptoms, because just because you feel well is even more reason why you should have a scan.
Sure.
Because then we can help you, because you're a well person having an operation.
So the earlier that you are diagnosed, the better the prognosis. Yeah. So I think it's really important, and that message needs to go out far and wide, because and you are doing that in terms of raising awareness. You're doing it through innovative ways, and you mentioned Minecraft before when we were doing that. So tell us a little bit about what that approach.
So I've got 2 young boys. They're now 13 and 10, and they play a bit of cricket, Idrees, and I think you've seen a bit of cricket pitch. And, we meet a lot of your community at the cricket pitches. Yeah. And they were playing a game that they got from school that was to do with internet security from Google. And I thought, well, I could do with that. I could do with a game bringing kids and cancer and gaming. And gaming as an educational tool, not gaming as something to keep them preoccupied on Saturday afternoon. And I've fought, and finally I've had some support from Minecraft, which is a subsidiary of Microsoft in Seattle, and with a UK charity, and we'll maybe come back and tell you more about it in the future, but there will be a big launch in September of a game that's really centred on the northeast of England and based in our hospital, and the things, looking to tell kids about what cancer is. So we reduce that taboo subject. It's just like the old recycling argument. Kids came home and said, mum and dad, don't throw out that bottle, recycle it. And the kids drove the recycling campaigns. I think we could do something about this with cancer with kids. So that kids go home and say, done this in school. Have you had all your mammography done? Granddad's had a cough for 4 weeks and hasn't reported. Another good symptom to report in, but had a cough that hasn't gone away. That's important to report to the GP. And maybe with the kids, and also there's a 1 in 2 chance that an adult will get cancer sometime during their lifetime. That means these children will be exposed to loved ones who potentially will have lung cancer, but have no knowledge to know what that means. I think we should actually tool these kids up with expertise that they know that it's not the death sentence that the senior generation we learnt of. And they can challenge those ideas, identical to the recycling argument, because they're going into these conversations blind. We need to go through education. The slow burners, they don't get it because they have health lifestyles, smoking, obesity, sun cream, all the usual things. But also they start peppering conversations up into the family around the kitchen table. I think the kitchen table is the best place for this. Around the kitchen table saying, you're smoking too much, you need to drop a bit of weight, or dad, or so-and-so's had coughed up some blood, or granddad's had a cough, or have you gone for your screening? Have you got any letters recently? Do we need to talk about that? There's a lot of kid power. Be careful, kids and cancer, because it's a very emotive subject, but I think it's one that we have to tackle. They tackle everything in schools now, from sexual health, sexual orientation, war, famine, everything. Cancer tends to be one that they don't go anywhere near. I think that's still a taboo subject within our society. And that is causing people not to get the care they want, the care they need.
So what do you think, what approach can we take? And I'm just looking at it from a project's perspective, but also the radio and sort of some of the faith communities that we work with. I think getting key messages out, through the mosques, for example, the imam can, when he's giving a sermon, they can discuss this topic around screening, around cancer. When you mentioned the schools, we've got a really good relationship with Acklam Grange schools in terms of how can we work with them to get awareness without these communities. And we can have youth cancer champions and work with them and give them information and awareness that they can take that knowledge back to the family table, as you were saying earlier.
But we have to give, from the imam down to the kids, we have to give them the tools that they can talk about it confidently. Because presumably they've come from an environment where it was never mentioned. So we're beating down those barriers. But we need community heroes. And if people are brave enough to come forward who have had cancer experience or living with cancer, living with and beyond cancer, and they want to come and talk about it, that is gold dust. Because that then stops the taboo. So people to come onto shows like this, or the papers, or the communities, or through the imam, or speak at faith centres, whatever their faith may be, to say, I've had it, and was well looked after, it wasn't as bad as I thought about it, please go and get yourself checked out. Those people will save lives. And these campaigns will save more lives than I will save over 30 years of operating in this town. Because the public health messaging brings in more people, more cures, than I will with 30 years of standing in the James Cook, cutting out lung cancer. It's useful, but it's just amazing.
Yeah, we've been speaking to some community members who are quite, active and prominent within their faith communities, and some of them have gone through the cancer treatment and they're a bit reluctant to share their stories, but we have 1 or 2 that are quite willing to come forward. So we are going to provide the platform for them, and maybe because this is going to be a conversation that you and I are going to have over the coming months. But I think what we can do is bring in some of the community members that have gone through the process, this the treatment they've had, the support they've had from the hospital, and people like yourselves that have treated them, and to share their experience.
Well, I'll give you a personal example. So I was this time yesterday I was in Ireland, visiting my 90-year-old father and 88-year-old mum. And Dad had prostate cancer 20 years ago. And he had radiotherapy and was cured. Obviously, he's 90 now, so he's fine. He's getting on. But when he had it, he turned around and said to me, I'll just slip up and down to the hospital, quietly get my radiotherapy. Nobody needs to know about it, and it'll just go away. And I said, well, it might go away, but you've been cured by getting a blood test. Do you not think you should tell all your mates? Because what happens if one of them was to die in a year's time or 2 years' time from prostate cancer, and you felt, if I had told them about that test, they might have got cured like me. So I said, you've got a social responsibility not to be quiet about it, and to go out and tell the world. this test has saved your life, because that will save more lives than many campaigns, because all those peppered conversations will happen about somebody. And he was a teacher in the community, so he's well known in the community. And that was great for him. And actually, that actually helped him in his recovery from cancer, living with cancer. That something good had come out of it. It wasn't all negative. It wasn't just cancer treatment symptoms. It was, I've done something that's important and it might help others. And that's how we're going to build that positive loop. Rather than a negative feedback loop, we're going to make it a positive feedback loop. So it just blossoms into common knowledge.
No, definitely. And it's important that people share their experience, and especially, if they can help, and your cohort of people that you work with, that you socialize with, you play cricket with, whatever. If you've gone and had this experience, or your family member, talk to them, share this information, and I think that can help other people. And apart from being a surgeon and working on supporting our communities, you are into cricket a bit as well.
Cricket. I don't teach very much. Cricket was not a great Irish sport. We didn't do a lot of cricket now. Although the West Indies were knocked out for 25 runs in 1960s or something in a place called Tunbridge. So it's said that I think the West Indies were knocked out by, who was this? Was it somebody? Was it this week for a very low score?
Yeah.
But actually, the Irish have got the record. So there you go. But we didn't do a lot of cricket at home. But my boys are steeped in cricket now, so I spend a lot of time around, because they're in a league around lots of local cricket clubs, and it's the most brilliant game, because not only is it cheap childcare for a few hours where you sit somewhere beautiful and watch cricket, but also the mixing of communities within that it goes beyond any sport.
Yeah, it's
play a lot of sport, but the integration of communities, cricket has it all. I mean, it's just amazing that way.
And how can we use cricket and the whole, because it brings, and I know quite a close friend of mine, and there's 3 generations that play cricket. My friend's father plays cricket, he plays cricket, and now his son plays cricket. And they all support the same sort of, and involved in the same team in terms of training and playing matches and things like that. So it's that sort of intergenerational activity. It's
And also, it's a safe environment. So I think the safest room in a house is the kitchen. Yeah. The safest room outside your house is probably if you've got a faith, is within your, wherever it be, the mosque or the church, wherever it be. And also, there's, for those who are not as much faith oriented, maybe their place of safety is a sporting club, especially through cricket. It's a very safe place, and a commonality about it. It's tapping into those people who feel secure enough to speak to somebody who they would not normally speak to about it, because they've got a common link through faith, family, or potentially cricket. You can start those conversations. It's all about chat. As the song said as we came in, I'm only one call away. That was, that's deliberate. You're only one call away from a completely life-changing event if you catch it early, or helping somebody and having that self-belief that you have actually stopped somebody going down a pathway of cancer that could have been avoided.
Just tell us a little bit about your links with the Ruth Strauss Foundation as well, in terms of cricket link and cancer.
So I've done this game for Minecraft, and the Ruth Strauss Foundation are the ones who have paid for it. And we'll come back and give a big launch. I'm hoping for a Northeast launch as well, because we don't want to be completely London-centric. But they're a lovely charity. It was Sir Andrew Strauss, the ex-cricketing captain for England. His wife passed away from non-smoking lung cancer. And they said it was charity to help kids who were being bereaved of their parents, but also the wider sort of conversation about cancer and about what it means. But it's aimed towards family dynamics. They're a most lovely bunch of people, and I think they raised over £330,000 on the second day of the test. The last test against India. For some of your community, that would be a test they want to forget because they didn't won. But we're not saying more about that. But the day when they all come out in red and everywhere's red, and I had red trousers on for that day, that's the Red for Ruth Day, and that's a very important day in the cricketing calendar to raise awareness, raise money. So it's been a delight to get to know them just over the last 12 months. Another charity that's coming to Middlesbrough, which we're super excited about, is a charity called Maggie's. Maggie's is a psychological support charity for cancer, and they're coming into our holistic centre in the James Cook as of October time. There'll be another big event for that. But we are really delighted to have that there, an international charity that helps support people with cancer. You don't need an appointment. You just walk in whenever it starts. You can walk in. You'll be welcomed and looked after if you've got anything worrying you about cancer. And we'll come back and talk about whenever they get started. But
Yeah,
it's amazing. They're an amazing bunch of people, and their sites where they do it is brilliant.
and as I was saying earlier, this is hopefully one of the first of many conversations, and I think we need to do this on a more regular basis. And I think I'm going to invite in some of the people that we've been speaking to in the communities, so we can have this sort of face-to-face conversation with them, with our listeners and viewers. And I think it's really important that those individuals have a platform to share their stories, because that's more powerful than myself and you talking
And
about
the biggest mistake that I always make is that I assume something. I assume that I know the needs of even an individual, never mind a community. So I want to stop that. We're not going to assume anything, Idrees, you and I, and that if anything comes in from your listeners they want to discuss, that should drive our conversations, not what I think is important or potentially what you think is important, but we should find out what the folk from your communities want us to talk about, because that they should drive the conversation, not me lecture with you.
And definitely, and we are looking to host another Lunch and Learn session, listeners' views. So if you'd like to get involved in that, the best number to contact is on WhatsApp. It's 01642 688 104. That's our studio number. If you'd like to get involved in any of our Lunch and Learn sessions in the near future. And if you or your family members have support from James Cook or any other hospital, and you've gone through this cancer journey, and if you'd like to share that with our listeners, our audience, whether it's through a radio program or a short interview, a video interview, or a piece for the social media, we'd love to hear from you guys, because it's really important that as I was saying, we provide this platform and share those stories as well, because I think it's important that the more we talk about it, the more we raise awareness, the more we demystify cancer, that is it's going to be better for the communities out there, and I think encourage more people to come forward. So we're going to wrap up our conversation right here, Johnny, but what's your final message to those people out there, and especially in terms of those that might be having some niggling doubts or not feeling well? What's your message out there in terms of, especially around lung cancer?
If you get a letter, it could be the most important letter of your life. When I sit on Christmas Day, when I celebrate Christmas, and my wife says to me, "What are you thinking about now?" I think of all the empty chairs around tables on teesside that we have avoided because we found those couple of hundred cancers. So, and the terrible devastation that a death in the family causes. So I think of the avoided empty chairs on Christmas Day. Maybe we should do that through Ramadan, maybe do all your celebrations, but avoiding empty chairs at times of family celebrations. That's why you go. That's why you encourage others to go.
Definitely. So do look out for that. And any screening opportunity you have, whether it's bowel cancer, whether it's breast cancer screening, cervical screening, just do look out for them, and encourage your family members or your partners to attend those appointments, because they're there and they do invite you for a reason. So please, the message today is, when you do receive that letter, act upon it. There's so many times people say, "Oh, by the way, I received that sort of bowel screening kit," and it's still there 2 months later. You've received an invitation for cervical screening, you haven't followed up on it. It's really important.
It is the most important letter of the year.
Yeah. So, Johnny, it's always a pleasure to see you, and thank you so much for coming to the studio. I know you're a busy man, but you made some time for us here on CBFM today.
Can I come back?
Yeah, you're more than welcome back, and we will pencil in some regular opportunities, and I'll say we'll try to line up some of our listeners as well, and the community members that have shown an interest in terms of supporting the project and sharing their stories. But we're going to hand over back to Baker as well, because back to the rest of drive time.